You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, healthcare for adults, and specifically what every Medicare patient or person eligible for Medicare needs to know about their options. With us, we have the medical director at Oak Street Health. With us, we have Dr. Julie Blankemeier. Dr. Blankemeier, welcome to the program.
Thank you, Randy, for having me. Really happy to be here.
So for people that don't know about Oak Street Health, who's the typical patient that you see?
So we take patients with Medicare. So that's anyone pretty much in the United States who's 65 years and older, or someone who has some kind of disability that they've been able to get on Medicare at a younger age. But it's interesting, when you ask me about a typical patient, I don't really have a typical patient. I have patients that are very healthy, and they come in because they have knee pain after 2 hours of exercising. I have other patients that have a couple medical problems, diabetes, hypertension, and we really want to stay on that to prevent problems. And then I have families that really come in because their parent has Alzheimer's. So I'm taking care of the family as well as a patient with Alzheimer's, or a patient who's at home but kind of barely making it. You know, their lives could be so much better.
What do you mean? What do you mean?
Well, they want to live at home, but they have a lot of disabilities. It's hard to get around home. They have problems making meals. They deal with insomnia, maybe depression. And so they come to us, and we can really make their home situation better. And we'll get into that, but that's about the whole holistic approach we have. So it's really for a range of patients. I have younger patients who are dealing with psychiatric issues, and we have behavioral health and psychiatrists. So we're really a first stop place for anybody on Medicare to make their life better.
So you have like this team approach, right? It's
Exactly.
a different model, right?
Yes,
I mean,
it's
you
a wonderful
guys
model.
are somewhat different than what patients are used to. Could you elaborate on that?
Yes, because, you know, any patient, but especially patients with Medicare, have a lot of different needs that all impact health. So there's just Medicare. You know how Medicare is so complicated, like any insurance program.
Yeah, it does seem complicated.
It is really complicated. I mean, even for me or you, you know, I get bills. I'm like, where did this come from? This isn't Medicare. But you have the Medicare, and then you have other insurances that people have. So we have a full-time person that even when you just come in, can go over with you all the benefits you have, what options if you have if you want other benefits. So to make that where it's not a problem, not an obstacle for you to get care. And then when you come in, you have my MA who does all her work.
Medical assistant.
Yes, thank you very much. Thanks for,
All right.
Yes, and they do more than the typical medical assistant. You know, we take care of, like as a provider, I have 500 patients that I take care of. Okay. And as opposed to a typical office, like where I would used to work, and your average, you know, load is about 2,500 patients. And my team stays together. So it's myself, my medical assistant, and my scribe, and we'll get into that in a moment. But we take care of the same 500 patients. They see us every time. So my medical assistant knows a patient. So when she comes and sees a patient, you know, she can go over medicines with them, review any questions they had that they want to ask before I come in. And then I have 20 to 40 minutes with the patient where it's just me. It's not time for the medical assistant. It's just me and my scribe. And the scribe I have in my team is usually someone who's going to medical school. So keeps that idealism going if someone's going to medical school. And they're there taking all the notes. And I tell my patients right away, this is my scribe. They usually, you know, we have just upbeat people, so they end up being a great part of the team. But that way I can sit and talk to you because they're taking all the notes. So I don't come in with my computer and sit down on my computer and start telling, you know, tell me about yourself. I come in and we just have a great conversation.
So the typical Medicare experience, you would go in, you would see your doctor, and it would be an alone time with the doctor, and the doctor may have to input things on their tablet or on the computer.
Yeah, I mean,
and you've eliminated all that at Oak Street.
Right. It's not just inputting. I mean, I don't know what your experience with going to see a doctor is, but in this day and age, you know, we're so concerned about our records, getting everything down. So, you know, usually you would come in with your computer and I go, okay, tell me what's going on. And then I'm looking at my computer, making sure I get it all down. Tell me about your past medical history, writing all that down. We don't have any of that. I'm just talking to you. Tell me why you're here. You know, tell me about your family. And I have the time and I have someone else taking notes. So I don't have anything interrupting our conversation of getting to know each other.
Now you guys refer to it as like VIP care.
Yes.
I mean, you spend a lot of time with patients. I mean, we're not talking 5 or 10 minutes.
Right. Isn't that wonderful? I mean, it's wonderful for the physician and it's wonderful for the patient.
You say you even have fun on these.
Oh.
That means because you have more time with patients.
Yes.
It's fun for you and it's better for the patient.
Yes.
What do you mean?
Like, well, you know, you get to know patients. You know, people are just amazing people. And here we're taking care of people generally who are 65 years and older. The stories, the wisdom is amazing. And we become a team. You know, I frequently tell my patients as, you know, we're getting to know each other. I said, you know, we're a team And my job is to get to know you and about your life and to see what you need to make your life better. And you're depending on me for my medical expertise, and I will share everything I can. But in the end, you're the captain. And whatever decisions you make, you have my full support.
Describe your center. So somebody goes into Oak Street. You have a lot of things going on. Tell me about that.
It's amazing. Okay, so you're not coming into a regular medical office building. We're kind of a storefront on one of your main streets in your town. And you walk in, and there's a community center right there where we have yoga classes, dance classes. Some centers have cooking classes. And then you're greeted by the person that welcomes you by your name. I mean, we're a family. You're not a number.
Okay.
And then you come back, and you're led back. This is the other thing. You know, sometimes I have children that will bring their parents the first time. And as you may know, we have transportation, complimentary transportation for all our patients.
So for people on Medicare, if they live like within 5 or 8 miles or so, you'll pick them up and drop them off?
Yes, because that's one of the huge obstacles to people, right? And our drivers are amazing. I mean, they're the first people that our patients get to see, and they have that same spirit, like, we are here to serve.
We've had this program for the last 20 years, right? And I've interviewed a lot of medical doctors.
Right.
And they will complain they just don't have the time to spend with patients. So you have the luxury of time at Oak Street.
We do. And
your whole model is based on this, right?
Right, and that gets to what's the philosophy at the top, right? So Oak Street's the third organization I've worked for, and I think every organization tries to do healthcare in a way that's good for patients. But you have a lot of constraints. So in this day and age, it really is how many patients can you see? How many of these product units can you get done? At Oak Street, our job is really to keep patients healthy and happy. And to do that, really, you have to have time to get to know your patients, know what the context of their lives are, know what their goals are.
I mean, some patients have actually told you they love you.
Yes, I mean, you know, and that's the beauty.
Right?
It's so wonderful. I mean, I actually get that more frequently than not. You know, most of my visits actually start or end with a hug. I mean, we are close with our patients. I'm close with my patients. And that's why I love it so much. But, you know, specifically, I had this one patient. She's about 80 years old. She has faced more of life's challenges than I can ever imagine. You know, and that's how most of my patients, I mean, you think of these 60, 70, 80-year-olds. Their life's experiences are amazing. And I get to learn about them. I get to sit there and learn about what their past, their present, what their hopes are still in the future. But this one patient, you know, came in and initially, you know, she sat back and like a lot of people, I'm going to check you out because I think I'm probably know more about me than you do. And the truth is that's what I believe too. So,
okay, good.
So, you know, she starts sharing that and telling me about herself and what she needs to be done. And, you know, that was the end of the visit. And she came back another time and just gave me a little sense of some of the challenges she's faced in her life. And I just thought, you know, there's so much more there that she needs to share. And I thought we were dealing with some anxiety issues, maybe a little depression. And I needed to understand that, but I knew it would take time. So even though we get 20 to 40 minutes, I thought, this patient, I'm having her come right before lunch, and we're going to just talk through lunch. So she came, and I just asked her a little bit more about her life, about her grandchildren, you know, things that she had faced. And so we had the 20 minutes, we had my lunch hour, and she walked out, and she turned to me, she goes, I love you. And I said, I love you too.
That's nice.
But the best response was she said, I know. And that sense of not only I love you, you love me, but I know you love me. And it's that sense that, you know, we are a team together, and we're in this together through thick and thin.
Now, there's a lot of people that are watching this that are currently on Medicare, and they're saying, well, they don't spend that much time with me. My doctor doesn't spend that much time with me. I don't get in on the same day if I had to.
Right.
Does it cost money to change over to you?
No, it is so easy.
But it's a lot of paperwork, it seems
like.
Well,
it's not. And that's what, you know, one of the great things about healthcare, about Oak Street with healthcare, is that it takes all that away. So they're probably dealing with more paperwork by staying where they are than coming to us. As I mentioned, we have a patient relations manager.
Okay.
So when patient first comes, this person finds out where they've been. We will automatically order the records over so they don't have to go back and ask for records, and that's fairly uncomfortable for patients. But we want to only order the records from the last physician. We'll order them from the places where they had procedures done, if they had a physician before that. I mean, we really want to know the history of this patient, medically and otherwise.
Okay.
But then our patients relations manager will make sure they understand Medicare, sometimes understand benefits that they didn't even know that they had. And then also let them know about other options, because within Medicare, there are a lot of options. You can stay with straight Medicare, you can get into Medicare Advantage
Well,
programs.
who goes over this with the patient? I mean,
This patient
do you have
relations
agents?
manager.
Do you have agents?
No,
there
we
too?
don't have
Okay.
agents. So this is the great thing. So she will kind of review the whole lay of the land with the patient.
All right.
And then if the patient does want to look at other options within Medicare, she will refer them to independent agents. So we're not selling the insurance, but we have actually vetted these people. So you know how you get a little nervous, you go to agents, you're like, what's this person, what's their, real motive here? Well, we've already vetted these people. So we can refer them to these independent agents that then can find a program that will meet the specific patient needs. So it's really easy. And not only that, one thing is getting on it. Then the next thing is with any of us with insurance, 3 months into it, all of a sudden you're like, where's this bill from or what happened here? So a patient will come into me and, we'll be talking about their medical things and then they'll pull out their big package of bills. And they said, I got all these bills. And quite honestly, in my old jobs, it's like, geez, I'm really sorry, but I don't take care of insurance. And now I can say, you met with Jeanette before. She can talk to you about this. She'll get this figured out. And 90% of the time, those were bills that happened between like the specialist and the insurance, something got mixed up, and those bills she can take care of and go away. So you don't have to call the insurance company and say, I don't understand this bill. Our professional will take care of that. And then if it happens that, let's say you're on a program, you're like, this really doesn't fit for me, I'll say, go back to Jeanette, and she'll talk about the other options and get with you an independent agent again. So the whole way, it's not just the first visit, but all those insurance things that you deal with throughout the year, we address. But that's that whole one. Can I go on? And
yeah, go ahead.
Because then actually when patients come to us, another big issue with regular insurance is, anxiety, depression, insomnia. Those are so common and really greatly impact the lives of so many people. But where I've been before, even with insurance, if you wanted to get mental health treatment, if you wanted to see a therapist, if you wanted to go to psychiatry, you had to go to another center, which always scares people. There's just this sense of, I have to see a psychiatrist or I have to see a therapist, even though, those are very valuable. People just have a hesitation. And then if we're able to get people past that hump, they now have a 3 to 6 month wait.
So what's the answer? I mean, what do you do?
So we have a therapist in our center.
Like a social worker kind of
Well,
thing?
we have a couple things. You have a good point. We have a social worker. So our social worker is more, what do you need in the home? Like, do you need Meals on Wheels? Do you need homemaker service? What is making it hard for you to live at home in the best way you can? So that we have a social worker.
This is all included? I mean,
yes. Not only is it included, but you can meet these people.
Okay.
Like during my meeting with the patient, as these things are coming up, this is the advantage of our Scribe 2. I'll say, Arturo, can you G-chat our social worker and see if they'll have time right now to meet with this patient? Because we need to see if there's homemaker services. We need if we can get Meals on Wheels. And then the patient would be talking to me, and it seems like they need physical therapy, but it's going to be too hard to get get out of the house. And I'll say, you know what, we can get physical therapy in your home. So we have that all where we can get that going in the office. But then they can meet with our social worker. So now we have a social worker, we have therapists, and we have telepsychiatry, all right there.
Is that right?
Yeah. So if you think about what really impacts people's health, food, housing, counseling, all these things we're addressing right there.
So when they go to your center,
yes,
you say there's very little waiting in the waiting room.
No, because
to be seen.
Right, because we have this 20 to 40 minute visits with patients. So usually as a physician, you're running. So we already have 20 to 40 minutes with patients, and then we're not double booked. So it's not like, oh my gosh, someone got double booked, now you have to wait. And I'm probably the worst in my center about taking the most time with patients. So sometimes I will run 10 minutes late, and the patients will be kind of upset with me. Like,
10
doctor,
minutes?
Yes, doctor, you were supposed to
Because they're used to getting right in.
Exactly.
Okay.
So part of me is like, I had to wait an hour for my patient. But the other part of me is like, thank God, and that they're empowered to say that. I mean, our patients question us. They hold us accountable because that's part of a team, right? They're comfortable. How many times do people go to physicians and you kind of feel like you're this small? In our center, the patient is the most important person.
This is kind of amazing. I'm not trying to side with you, but you don't hear this.
Right.
That where you, and I guess it's just because you're set up with time, more time with patients.
With time and people, and everyone loves what they're doing, and the patient is the center of it. It just makes it an incredible situation for the patient. Can I finish with this one patient though? Okay, so after she saw the counselor, we got the home situation going. It really came out that she was really lonely. Her husband had passed away many years ago, and since that time, she felt pretty alone. And we have this community room. I think we've talked about a little bit that they have bingo games, they have dance classes, and she couldn't get to the community room that easily. So I said, let's start making your appointments on bingo day. I bet you like bingo. So the van would go pick her up at her house, bring her in, she'd play bingo, and then we'd have the appointment. And this was when I felt like, this works, because she came in just happy, laughing. She'd never been like that before. And I said, you came for bingo? And she said, yeah. And she was, and I won. And she held up her fabric softener that she won. And it was a totally different person. And, now she comes in and, I tell her, I go, I love seeing you. And she goes, I know you do. And her whole perspective on life, her demeanor has just changed 180. And it is interesting, with this community room.
Yeah.
I have another patient that joined us just for the community room.
Okay.
She liked her physician, but she knew she needed more social outlets, and so this community room does so much.
So people use it.
People use it a lot.
Okay.
So this was a fun example. So I received her lab tests back, and I thought, I got to call her to make a little change in medication. It was probably about 1 o'clock on a weekday. So I called her up, and I was trying to talk to her, but it was really loud in the background. And I thought, that's kind of unusual. This is midday. It's pretty loud. But I just thought, are you at a party? Should I give you a call later? And she goes, no, I'm in the front of the clinic. She was at one of our dance classes. So I said, okay, we'll talk in a second. I hung up, walked to the front and pulled her aside, and we talked, and then she went back to her dance class.
Places like Oak Street, they're not everywhere. In fact, anticipating you coming in today,
yes,
I talked to some of my medical doctor friends, and I said, these people are giving like VIP concierge service to people on Medicare and Medicaid.
Yes.
And they go, how are they doing it? And my understanding from talking to you is that your reimbursement is almost by keeping people out of the hospital, by keeping them healthy.
Right, exactly. So we're like what they call value-based medicine. So the more we can keep people from expensive care that might not be appropriate if we took care of things ahead of time, that's how our reimbursement works. But that won't stop us from getting expensive care when patients need it.
Yeah.
But it's what everyone wants. I mean, who really wants to be in the hospital? So if I can see you, this is another patient. So I had a patient with congestive heart failure.
Okay.
Before he came to our clinic, he had been in the hospital literally about every month. And he came to our site. And so you think, okay, it would be great to keep him out of the hospital for multiple reasons. So he came in again with his children the first time. He lives with his children. They're very attentive. And we went over his medications and, over his symptoms and all that. And I couldn't quite figure out why he had ended up being in the hospital so much. So we had to, when we have patients that we consider that, that they're at high risk for being in the hospital, we'll see them every 3 weeks. Whatever we need to do to keep them healthy. Came 3 weeks later, we went over his medication list again because we have time to do that. The medicines were different. I'm like, what's going on here? So we went over the medications they told us that time. We went over the medications last time. I kind of tried to put them together and figure out what would be best for this patient. We don't want him on multiple medications and getting confused. Came in for another visit 3 weeks later, another list of medications. Clearly what had happened was because he was getting care from different places in the hospital, medications were being changed all the time. He probably had bags full of medications at home, and every time he came in, there were different ones that he'd grabbed. So it was just a matter of going over, saying, okay, let's bring in all your medications.
It makes sense. I mean, if they put you in charge of their healthcare, like you're my primary care physician, you tell me what to do, it makes it easier.
Yeah, and then you find, taking the time with patients, like if I just saw him that one time, went over his medications and saw him, said, call me when you're having problems, I would have never known that these medications were getting mixed and matched and all that.
Now, for the people with a lot of money or the wealthy, they have their own doctors with concierge medicine, where you pay them $5,000 a year or $10,000 a year.
Right.
And you get to see them whenever you like and spend like 30 or 40 minutes with them.
Right.
And this sounds just like that, except for a bigger team.
Yes, I would argue it's even more than that. It is interesting how people get disconnected from a healthcare system, right? So some people, have these concierge medicine and they think it's, a phenomenal system. And we do have that, but we have that because it makes sense for our patients and it makes sense for us. And it really should be probably how healthcare is provided for everybody. So, to avoid people going into the hospital, we want to have that personal relationship. We want to know what's going on. We see people everywhere from 3 weeks to 3 months. And then as you say, if they have a problem, we'll see them within 24 hours. We want them in and have that relationship. But we also have the social services to help them with any other issues they have, the counseling. We also have pharmacy services. So
certain meds they could pick up there?
Yes. So we have a partnership with a pharmacy. My particular site has a pharmacy right in center. Others of our centers, this pharmacy is not right there, but we work with them and medicines can be sent out for them. But this is just, when you talk about concierge medicine, something else that our patients get, but it just makes sense. I had a patient who came in and she was not getting her medications, and I was trying to figure out what was going on. And it wasn't just one thing, like it was that they were expensive. that they had to be mailed out to her house, but then she was in an apartment building, so she wasn't necessarily getting them. So we actually brought her 2 sons in, and then I brought the pharmacist in from our site, and we sat down there and we talked about how to best package her medicine, how to get to them to her, what day would they arrive so the sons knew to pick them up. So it's, again, everyone working together.
People must be surprised when they hear this. I mean, do patients ever say, you know, especially the ones that were doing this elsewhere, and then they go to Oak Street, aren't they ever saying, you know, I've never been treated this way?
Well, you know, we get that on the welcome visits. You know, people always come in, you know, so our welcome visit is the first visit you come, you know, and we don't call it a trial visit. It's really to welcome you into our center. And frequently, you know, I'll walk in, the patient's very anxious, and I'll just sit down and start talking to them and listening to them and hearing about their stories. I said the stories are just fascinating. And they'll finish up and they'll be like, I think I'm coming here. And you can just see the light bulb go off.
Now, what about those people that are kind of lost in the paperwork?
Yeah.
And I know people like this, that their idea of healthcare is going and sitting at an urgent care a couple of times a year to get an antibiotic. What do you say to those people that think Medicare is just not for them?
Exactly. And that's where we help people out a lot, because I think a lot of those people would like a doctor in the middle of the night and something's going wrong. You know, you don't really want to go to the emergency room. How much are people like, oh, do I have to go? Do I not? And you can just call us. I mean, there's a doctor available 24/7 every day. And urgent care will see you just like an urgent care, but you'll see someone who knows you and values you so much.
Okay. So we're short on time, but if somebody's watching this, they're not happy with their current situation, maybe they're on Medicare, they don't spend enough time with their primary care physician, maybe they don't even know they have a primary care physician. What's their first move to get involved with Oak Street?
Okay, so first of all, this is just an incredible center, so I think the first move is really important. And really, they just have to call the phone number for Oak Street. Someone will respond to them. They'll set up the appointment, and a green van will go out and pick them up at their door, and everything's taken care of. And let me just tell you, I actually had this experience. So right before I started at Oak Street, I was working in another center, and I had a good friend, Jimmy, who was having severe back pain. Just a friend, and he doesn't live that far actually from our center. So I happened to just call him up that day, and he's like, Julie, I'm not doing well at all. My doctor can't see me. And I could just tell in his voice he was in tons of pain. And I said, Jimmy, where I'm going to be working next is right close to you. Let me call and see if I can get an appointment scheduled for you. So I called Oak Street thinking I'd set up the appointment. And I just said, I need to get a person in for an appointment there. I'm a physician. And they said, thank you, doctor. We'll take care of it. Give us this patient's number. We've got it. And I was kind of like, I want to make the appointment. They go, no, we got it. They called him up, made the appointment. When I called Jimmy back the next day, I said, how'd it go? He goes, Julie, this was amazing. He goes, they called me. They said they were going to pick me up so I could see a physician right away. They called me before they left the center. They called me in front of my house 2 minutes early before they said they were going to come and said, I'm there. They brought me in. He said, I met with somebody that explained Medicare to me that I never knew. They gave me a T-shirt. They gave me food, which for him at that moment actually was really important. And he goes, and then I saw this provider, who actually is one of our excellent providers, and he goes, not only did she take care of my pain right then, but I'm already set up for lab tests and my physical.
Nice.
Yeah, it was an incredible experience, and I had to do nothing other than to call that number and say this person needs an appointment, and it was all taken care of.
So if somebody's watching this, they give you a call.
Right.
How soon could somebody get started? If they say, okay, I've heard what she has to say, maybe it's hard to believe that they're going to get this much attention.
Yes.
If they call, how soon could they see a doctor?
Most of our centers that day.
Okay, really?
Yes. We have slots, we have slots put aside to take care of patients, whether ill patients, new patients right outside just got discharged from the hospital that day. So they'll call and they'll get them into a welcome visit with a provider. They'll probably end up spending about 2 hours at our center.
Is that right?
Yes, because they'll meet with this person that I talked about that would explain insurance to them, find out if they want a different program to set them up with an independent agent. Then they'll get all the history from my medical assistant. Then they'll get 40 minutes with the physician and then setting up for the next appointment.
And that's an ongoing relationship, right? I mean, that first one might be 40 minutes, but every time they go in, it's going to be like 20 minutes.
It's at least 20 minutes, yeah. They'll probably be back for another 40-minute visit soon after that when we do their complete physical, their complete history, get everything, ordered after the labs are done. So they'll have a couple 40-minute visits and several 20-minute visits. And they'll see us, if they're healthy, we'd still like to see you every 3 months to keep you that way. If there's problems, we frequently see people every 3 weeks.
Now, I spoke to one of your founders,
Yes.
Griffin
Yes.
Myers.
Yes.
And one of the things he said, and I'm paraphrasing slightly, because I asked him the same question on the phone, what makes you different? He goes, the key for all of this to work is you got to find doctors that really care.
Yes.
He goes, and I could spot the ones that care. Something like that.
Yeah. And it's a phenomenal setup, because I think a lot of physicians want to work in this setting. So I'm sure he gets emailed and contacted by many of us. But truthfully, the people who end up there are the people they've decided that really enjoy patient care. And even my office, the people that are there, they're upbeat, positive people that thrive on personal relationships.
And Medicare and Medicaid covers all of this.
Yes.
And it is this.
And not only all of this, to get into another thing, I've gotten into more about insurance. So, a lot of people, they have programs that they have memberships to fitness centers, and they did not even know that. So in Chicago, cold weather, exercise, nutrition is key to so many things. So I'll be talking to my patient. I said, so how about exercise? And I was taking walks while it's summer, but it's winter now, so I'm not. And I'll look up at their insurance. I'll say, you can join the local YMCA or LA Fitness for free. They had no idea. It was a benefit they had and they didn't know. And we're aware of all that. Or they need to go see a specialist, and we can give them transportation to our site, but they're like, I can't go see that specialist. And I'll look it up and say, your insurance actually pays for transportation to go see the specialist.
Wow. And we should mention you speak Spanish.
Yes.
I asked you, well, how? Because you don't look like you speak Spanish to me.
Right, exactly.
Fluently.
Yes.
So about 70% of your patients, you're actually in the room speaking Spanish to them.
Yes.
Is that right?
It's true. And Oak Street has done a great job. Actually, at our center, because we are in a mainly Latino area, all of our providers, all of our staff are being bilingual Spanish and English. And that's, again, being part of the community. So our centers are in all different neighborhoods, and people speak Spanish, people speak Polish. So Oak Street really tries to make sure that they have providers that can speak the language of the patients in whatever neighborhood that they're in.
So I want to thank you for coming on the show. But when you were on the plane, headed out here,
Yes.
What was your main thing you wanted to let people know?
I wanted to let them know that there's a place where they can get care, where people really value them, value their past, their present, their future goals, and really want to make life as great for them as life can be.
And for people that aren't really savvy with getting involved in Medicare or signed up for Medicare, you walk them through all of that, help them with the
Don't need to be
paperwork?
savvy at all. It is really, they've put up all the resources to make it possible for you to live a healthy, happy life. You don't need to know about Medicare. You don't need to know about where you have to go for specialists. We really take care of all that.
Final message, somebody watching this, they're not happy with their current situation as far as their health goes and their health care.
Yeah.
And maybe they're skeptical. Maybe it sounds almost too good to be true.
Right.
What do you say to them?
Just try us. Just all you have to do is make a phone call. Our vans will come pick you up at your door.
Is that right? Okay.
Just come in and just get one experience. I'm really confident that they'll understand then what the Oak Street experience is.
Oh, thank you for coming in. Great stuff.
Great.
to
Thanks
have you
for
on the
having
show.
me, Randy.
You've been watching the Wellness Hour, news that makes you healthier. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.